This time of year, we hear a lot of talk about people who suffer from colds and flu, but also pertussis, known, I think, more commonly as whooping cough. And I grew up in an area where we had a large Amish community, and they didn't believe in getting vaccinated against that. And this time of year, we would often have various outbreaks. But we wanted to address some of these issues today with the good folks from Trip Family Medicine here in Twin Falls. We should point out Trip Family Medicine is located on Fillmore Street in the city, directly across from the main post office. I actually met someone yesterday when I was in Filer who told me that they had become a patient of the office after hearing the doctor and the staff on the air. We should point out Dr. Tripp is joining us this morning, but also Lauren, and again, it's Bostrom, right?
Yes, that's correct.
I hope I can keep getting that right, because Lauren's going to be back more and more often joining us in studio as well, because the doctor comes along with some of the physician assistants and other staffers who work in his office. But welcome to both of you today.
Good morning.
You dressed well.
Yeah, well, okay. Yeah, it's cold out today.
I was 16 when I got up this morning, and I'm sure it's not a heck of a lot warmer.
It is the real deal winter out there, and we have a topic that's perfect for what's going on in our office and around town and around the state. And so we briefly introduced Lauren as our new physician assistant about almost a month ago now. She's becoming an old timer, and I won't say a figure of the office yet, like one of those statues in the lobby kind of thing. She's not that. But I will tell you, our experience so far with Lauren is that patients love her. She's very bright, quick to understand what's going on, and pretty open to hearing, patients' interests or how they'd like to handle their medical health care. And I would say a theme between her and I working together this last month has been we're all about giving options and choices. And, if people want to do things a little differently, most of the time are okay. Sometimes when they say, hey, I have a life-threatening disease and I think I'm going to take only vitamin C for it, we usually have a little different discussion. But we definitely, one size does not fit all at our offices. I'd say that's a pretty constant theme what you've seen this last month.
The other day I was outside. I had to run to my car for something, and one of the neighbors said to me, because I ran outside in a short sleeve shirt, that I was going to catch cold. Here we go again. This time of year, that old tale just doesn't go away. That a cold day like today is going to cause some sort of a cold. There are other reasons you get colds and flu and these things in winter. It's got nothing to do with the temperature, though.
Yeah, the truth is studies have been done where they put people in, isolated coolers and drop their body temperatures and things like that. If they're isolated, they don't catch a cold. They don't, get more sick than the next person that didn't get put in the cooler. But you combine that where you're fighting your immune system by lowering your body temperature or putting it at extremes, along with exposure, I would say your likelihood naturally would go up that you're going to catch something if your immune system is suppressed. So that's kind of something I think that still holds true, but if you put it into isolated studies, no, they don't find that colds go up just because of cold.
And, we talked, I think, before this time of year, two people, if you're at church, for instance, and you're shaking hands, you have these confined spaces where this is going on a lot. That's where you start seeing the increase in colds. By Tuesday, you'll see a big uptick in this community, usually
It's
after
fun.
incubation.
Did we talk about Tuesday that way before? Because I'll tell you what, that's a personal experience. We homeschooled our kids when they were little, and so their only main public exposure was the sports they were involved in or other activities. But it seemed like every Tuesday was when they got sick, and sure enough, they'd been to church on Sunday and shared with whoever was around. So it's funny you come up with the same conclusion. We are not supporting the idea that you should skip church.
Right.
If you have bone marrow cancer and you can't support any kind of immune system, I'd say, yeah, church on TV might be a better move. But, for the majority of us, going to church probably still a good idea.
I noticed a woman at church a few years ago. She would pull out a little bottle of hand sanitizer after she finished shaking hands and would wipe her hands down this time of year.
Not a bad move. Lauren's pretty good at that.
I do like the hand sanitizer. It's a good thing.
So it will offer some, at least, protection in that situation.
Hey, let's talk about our topic a little bit, but maybe we can get back to having Lauren tell
Yeah,
us
we've
a
got
little
about
bit
a
about
minute
her
before the
experience.
first break, so we can dive into it now.
So we'll talk about the actual um, topic itself, if I can get my computer to work with me, which is also called my phone. But this is a topic that I said, it's the parent's guide to cough, colds, strep throat, mono, and the flu, and how to distinguish between them. Because really, what we want to hit at everybody, this is a topic applicable to everybody, but what we really want to target at is, when do I need to bring my kids in? Because everybody gets sniffles, that's okay. But how do I distinguish between something very benign and something that needs, prescription, medical treatment, or could be threatening? And so that's what we're going to go after the break.
We want to thank Dr. Tripp and, of course, Lauren for popping in today, too, as well. And we've got more on the way in the next 20 minutes. Should point out as well, too, if you have a comment or question for them while they're in the studio, the telephone number is 208 736 0300. Wanted to mention, of course, we've got the doctor and the PA in studio with us today and from Tripp Family Medicine, and we're talking about this time of year and also treatment of colds and flu and whooping cough and the like. And telephone number, if you'd like to reach us, is 208-736-0300. And we have a caller joining us. Turn our music down here a little bit. Caller, you're up next. You're on the air with the doctor and the PA. Go ahead.
Yes, I'm a regular listener. My name is Rob. I enjoy your show very much. I remember the episode when you had her first introduced the PA to the practice, and something I missed, or maybe it wasn't covered, is educationally, is a PA a step toward becoming a doctor, or is a PA, and that's where they stop, or is that a career progression? Can she go beyond that to become a physician if she so desired?
That is a great question. I'm going to let Lauren answer it.
So, as a physician assistant, it really can be kind of your career for the rest of your life.
Without debt, but go ahead.
There's still some good debt in there. But as far as training, we go through undergrad school, and then we go through a master's program for physician assistant studies. The first year, we are in the classroom for the whole entire year, straight through, running through those books. And then the second year, we spend all our time doing rotations over the weekends, no breaks, and learning from other providers and physicians with direct patient care. And then following that, we start our career and practice under a physician that's able to kind of help guide us if we have any questions. But in the family practice setting, we're really kind of seeing patients as kind of Dr. Tripp would in the office, and treating them, diagnosing, prescribing. And that's usually kind of a long-term career path for most of us.
Yeah. Now, a physician assistant, because they have that master's degree and have that background, that experience, they would be a good candidate for medical school. On the other hand, if they're crazy, want more debt and more time without any income, then they go to medical school. But no, as a physician assistant, at least in my office, and this is my philosophy of how a physician assistant is supposed to be under the direction of a physician, not only to gain further experience, but to have that depth of knowledge that comes through medical school and residency that is a longer training period. But the truth is we share the patients, we share the concerns, we share the diagnoses, the treatments, and so in particular in our office, all of the providers are sitting in the same office. So frequently we're kind of tossing questions back and forth with each other, and I'm consulting with them just as much as they're consulting with me. And I get great information because four of us it's much easier to keep up to date on what's the latest and greatest than it is just a single person that's trying to see all the patients. So I really think it's kind of an ideal environment, and it allows us to let people get in sooner, meaning if you're sick or you're hurt, our intent is to get you there the same day, and to get you seen, get you taken care of. And often, we're seeing people with acute appendicitis or, lacerations or, obviously upper respiratory troubles. Yesterday seemed to be a theme of pneumonia starting our morning. We had 2 people that were pretty sure that, have been walking around with pneumonia and struggling. And so, we're often seeing things that could go to the emergency room, but we can usually take care of outpatient unless they're in dire straits. So
You,
having a PA is a strong asset to the practice.
you mentioned that the fact that you've got all these different people you can consult with, and one of the topics today, colds, flu, strep throat, whooping cough, and even mononucleosis. Somebody coming in, as you point out, the conundrum is they all seem to look alike. So now you've got a group of people, though, you can consult with to come up with an idea of what that patient may have.
And also, what else have you been seeing that I haven't been seeing? So that is a help to see what's going on in the community. So I'm going to let Lauren start off with where do we start? Because most people kind of understand what a cold is, and then we're going to go through how do you tell the difference between the other things?
Yeah, so kind of starting with the common cold, we're looking at people coming in with more nasal congestion, watery eyes, kind of a few days of illness, starting out, kind of temperatures peaking around 102. They may be starting to feel worse over kind of a 3 to 5 day course. And a lot of times, people start to feel a little bit better once we kind of get over that 5 day peak. And then we're kind of going, when do we need to be concerned about the flu?
Yep.
And there's a lot of times you can look at someone. There's a big difference between someone you see walking around with a cold and someone walking around with the flu. They're looking pretty sick. Their fevers tend to be higher. We're looking kind of more in the 105, 104 in the beginning of the illness, and the body aches. And so that's one of the big things you'll see different from a cold. We're getting people coming in with body aches.
And we're talking about children at this point, because if I have a patient, an adult that's 104 or 5, we're really in trouble. But for most adults, their fever is going to be 101 plus. If they have a common cold, rarely do they have a fever, whereas kids with a common cold can have up to about 102, and that's part of the normal. So with kiddos, what you're looking for is they feel just really run down. I mean, they are really slowed down, not just like, hey, I got a runny nose and I'm a little cranky, but you give me a little ibuprofen and I'm back to 100% running around like normal. With the flu, they have serious body aches that they can't tell you about. And so and their fever is generally higher. And so as a result, they are just slow. And, as a parent, you're looking at this kiddo and saying, you are just in a world of hurt and you can't even tell me why. But the good news is they still have the cold symptoms. So that's your big hint. A lot of people mistake the flu as nausea, vomiting, diarrhea, and they say, well, my kid doesn't have diarrhea. They're not throwing up. They must not have the flu. That's misguided information. In fact, kind of not a true flu, but a lot of people talk about the stomach flu, and I'm okay if we separate those two. But the real flu looks like a cold with a higher fever, body aches, and you are sicker. I mean, just really sicker. And the hard part is, Lauren just talked about a cold being, 3 to 5 days the worst, and then it starts to get better. Well, the flu, if we can get it in the first 2 to 3 days, we have good effective treatment for it. But by about day 5 or 6, we're kind of letting it run its course and just watching for, a subsequent pneumonia that can catch up and take over, that's secondary to the flu. So, when do you start? Well, you're looking for the really rundown state. You're looking for the higher fever. And especially if there's any trouble with, breathing or getting fluids in, because kids can go without, food for a few 3 days, but they can't do without fluids. So those are your big symptom changers.
Now, when you mentioned whooping cough, and I didn't realize this until you sent along the primer for today, that cough can last for months.
Yes.
That's an indicator that you may have that.
Why don't you go ahead and talk on that, Lauren?
Yeah, so the reason this is such a big topic, especially here, is there's now been an epidemic reported in Ada County, so not far from us, which means it's probably here. And the concern being that if we catch this early enough, we can actually give antibiotics to help treat it. But they say kind of after the 2 week mark, it may not be as effective. And so we're wanting to catch this a little bit earlier. And it's also one of those that can be kind of hard to distinguish from the common cold. So what we're looking at is people who are having kind of coughing spells to the point when they're having these coughing spells, they can't really breathe. They're almost wheezing or catching their breath, um, that these spells are so severe. And if we don't catch this early, especially in our kiddos and older folks, it actually could be deadly for them. And if we can get you treated quicker, then maybe we can prevent that 3-month cough and the spread of this through
I
our
don't,
area.
I don't know that I've ever had that, but most of these things on the list I have, strep throat being one of them. I think I was in the 7th or 8th grade when I had that. And the one reason I remember it is because how dry and sore my throat was for a week or so.
It's interesting with strep throat. That's probably the easy one for me to help you distinguish. Most people don't get nasal congestion. They really don't get a cough. Their main symptoms are, man, this just hit me in a few hours. I was feeling fine, and now I'm feeling terrible, or I woke up with this. And often the headache comes first. But a headache and a sore throat, pretty intense sore throat, usually come pretty close together within a few hours of each other. And that and a fever are the main symptoms. So, your throat hurts, you got a headache, you can have body aches, but the congestion sometimes is there, but that's fairly rare. And so as a parent, what are you looking for? Well, you're checking your kid's throat and you're looking for tonsils. If they don't have tonsils, that's a different story. But with tonsils, they swell, they get what's called a beefy red. So if you think of freshly ground hamburger at the grocery store, that red that's on the hamburger, that shouldn't be a normal red in your kid's mouth. So if you see that, that's a good symptom or a true symptom for strep. And then the other is white on the tonsils itself. So like what's called an exudate, or it's actually like pus on the tonsils. That's a big hint to say there's something more going on here than just my average cold.
There's going to be a fever too.
Generally, there is, yes. Some adults, I've seen plenty of adults that have no fever but have all the other symptoms. But they'll tell me, hey, this hit me like a ton of bricks, and within a few hours. That's where strep usually shows up. The other thing is that I'm going to shift over to mono a little bit because that same white pus or exudate on the tonsils can be mono. And I don't have an antibiotic to cure mono. But mono is really distinguished by just being really run down. In fact, as I wrote in the outline, let me just kind of quote it. It says, mono, the main feature is feeling tired, run down, and tired. Did I make that feature pretty clear? But people do. They'll just come in and say, I just don't feel good, and I'm just dragging my butt around. Now, I don't know if I'm allowed to use that on the air, but I think I'm okay with that one. But they really do. They feel like they're dragging, and they may not have had much in the way of cold symptoms, but when it hits hard and hits fast, it is big time sore throat, big swollen tonsils, troubles swallowing, and some will even worry about trouble breathing because those tonsils can get that big that they're nearly blocking the airway. So if that's the case, absolutely come see us. There are things we can do to reduce those symptoms quickly, within 24 hours. But supportive care is really the main thing, where we vote for a lot of things like vitamin C, vitamin D, and a slew of the B vitamins as far as supporting your immune system and your energy level to try to help you get over this. But there is no cure for mono. It is viral.
It was the last time I've ever been hospitalized in my life. My senior year of college, I had to spend a few days in an infirmary because of mononucleosis after a diagnosis of it. And I'll tell you what, it was not a fun time. And the first few days, the fever was pretty intense.
Well, should we ask how you got it? Because it's called the kissing disease.
Yeah, I'm not quite sure. Nobody else that I knew had it.
Wait. Shouldn't you have answered that? I don't recall.
When you're this old now, that's a catch-all for everything.
No, that comes from a prior president.
Yes.
I don't recall.
But the thing is I remember that intense fever that started all of this, and I went to get that checked out, and they checked me in and said, you're going to be here for a while.
We're going to keep you, huh?
And so I was there nearly a week, and then they told me it would be a good 6 weeks of full recovery that would follow it. And so I was very careful, got a lot of sleep that final semester of college, and got through it all. But it was definitely a challenge, and I'd never really been sick before, and to have that come over me was a real shocker.
No, go ahead.
I guess one thing I wanted to add in, as far as kids go, what we get really concerned about is with strep, with treating it, is we can get a lot of complications from that when we're younger. that we're not so concerned about when we're older, but kids can suffer actually some kidney problems if that's left untreated. And so it's important to bring your kid in if you are concerned.
Yeah, and it's not just the kids. I've seen for the, and my career is pretty good depth through ER and urgent care and, 900 bed hospitals with very serious illness. But strep, the sore throat is not the reason we treat with the antibiotics. It's the toxins from the strep that affect your kidneys, you can affect your heart valves and your vascular. And I saw starting about 2 weeks ago, a condition on a young lady who's mom of about 3 kids, and she's, I'll make it up, but about 30 years old, so not a little child, and she had this weird stuff showing up on her legs that looked like really intense hives, but they were just a few, and they became kind of discolored and they turned kind of purple. And it's actually a condition caused by the strep that she had probably about 2 weeks earlier that was never treated. How do we know that? Because once we figured out what it was, we went backwards and said, before this all started, had you had a cold? We use those terms, and she says, I did have a sore throat about 2 weeks prior to all this starting. And so, the condition was textbook, but, it's fairly rare, but that's the reason why we're really treating strep throat pretty aggressively.
Now, you also wanted to reference pneumonia today, and some of these things obviously have vaccines you can get in advance. For some pneumonias, that works too, but maybe not all.
Go ahead.
So, as far as pneumonia goes, we're looking for people who are walking around puffing for air and trying to catch their breath, and really, really more struggling as far as a cough, but really just feeling kind of winded and short of breath and run down. And there's different types of pneumonia. Usually we'll be trying to throw an antibiotic at them, but there are some viral types too that can really put people in the hospital because we need to monitor them closely and give them some supportive care.
I wanted to point out some people never know they even have it, right? They'll go through it and then.
Yeah, that is true. People use the term walking pneumonia. And the only thing that really distinguishes walking pneumonia from pneumonia in bed is you're not in bed. So, if you are so sick that you're bedridden, and it's caused by pneumonia, you are going to just struggle with fevers and chills and just, trouble breathing and moving from the bedroom to the bathroom. But a lot of people, kids in particular, will be running around. They won't run as fast. In fact, the daily tasks that you normally do really start running you down, and you get short of breath for nothing, and you're really surprised by it. So pneumonia can be kind of subtle, but if you got fever, chills, body aches, let's take a look.
If someone has a question or comment after the show today, how can they reach you at the office?
Area code 208-933-4400. That's 933-4400. You can also reach us on Facebook at Tripp Family Medicine and on the web at trippfamilymedicine.com. And Pertussis, whooping cough, best way to prevent it is get your tetanus, and it's actually a pertussis booster, so a Tdap, and that's every 10 years, and you will keep out of trouble.
I want to thank both the PA and the doctor for dropping in today. We've got a break for 9 o'clock news. Pastor Paul Thompson is going to be joining us just after the 9 o'clock hour, right here on News Radio 1310 KLIX.